Now, let's talk about one statistic in the US that is pandemic related that is really not looking very good. And that is that hospitalizations in the United States are rising, not overall, but in areas with low vaccination rates. Now, we've been talking for months at this point in time. If 20% of the country never gets vaccinated, which the latest polling we have is that 20% of the country does not plan to get the coronavirus vaccine, what's going to happen? Well, we'll never eradicate it fully. We may never anyway, but in addition to not eradicating it fully, you're going to see these clusters pop up in the areas that have a lower percentage of the population vaccinated. And statistically speaking, most of the people who get it will be the unvaccinated. But the vaccines aren't 100% effective. When we say 94, 95%, that means roughly 1 out of 20 people who get vaccinated do not develop antibodies. So these unvaccinated areas will also lead to some vaccinated people getting sick. And statistically, if enough of them get sick, some of those people are going to die. This is happening now. We had the idea maybe that would be at the end of summer, maybe into the fall or winter where you would start to see these clusters. They're happening now. There's a new New York Times report which says in the US, hospitalizations are rising in areas with low vaccination rates. Health officials worry that COVID-19 hospitalization rates could increase among the unvaccinated as variants of the virus spread. The coronavirus might be receding in much of the US, this article writes, but it continues to spread in communities with low COVID vaccination rates where highly contagious virus variants pose a threat to those who have not had shots. As an example, the article mentions Smith County, Tennessee. Only 20% of the population in Smith County, Tennessee are fully vaccinated. And there has been a 700% increase in hospitalizations for COVID-19 over the last 2 weeks, according to the New York Times database. Another example, in Truesdale, Tennessee, or maybe it's pronounced Trousdale, 23% of the population is fully vaccinated. Hospitalizations up 700%. This is not a coincidence. Dr. Ted Delbridge says in most age groups, people who become ill are twice as likely to end up hospitalized as people who got the virus earlier in the pandemic. What does this mean? This means that these variants are not only more contagious, but more likely to make you sick if you are not vaccinated. So all else being equal, if you have 50% of the population unvaccinated now versus at some previous point, now more likely people are going to get really sick and sick enough to get hospitalized because of these variants. In Maryland, of those between 50 and 59 years of age who got COVID over the winter, 8% were hospitalized. From April on, 19% of people in that age group who got the virus were hospitalized. And the vaccines protect you. This is not going to stop. This is not going to go away in this way. And I know that there's a lot of tough talk about I'm healthy, I eat a good diet, I exercise, etc. That doesn't protect you from COVID-19. And as the variants that are predominant are more transmissible and or more likely to put you in the hospital, you are taking a real big risk by being unvaccinated, but you are also putting other people at risk. At this point, it's like a broken record. I don't know how many times it has to be said. The vaccines are effective against the variants. They are slightly less effective against some of the most recent variants, but you get really good protection from all known variants so far if you just go and get vaccinated. And so we talked earlier about the numbers. We're now down to about 14,000 cases per day. It's really quite low, some of the lowest we've been at for a while. Where do we go from here? Where do we go from here if we continue to see this vaccine hesitancy? So a little bit later, we're going to talk about Biden's infrastructure negotiations and some other things. Later, we're going to actually have video from a hearing where attendees were arguing against any kind of required vaccination. And the nuttery is growing significantly. The nuttery is spreading like a virus. So we're going to talk about that later. We're going to talk about lab leak. But send me your thoughts. How low do you think cases can go if 20% of the population really refuses to get themselves vaccinated? Let me know. You can find me on Twitter at dpakman.